Hello everyone, this is Dr. Apeksha Merja. I am an MD dermatologist. I have been practicing at Enliven Skin MD Clinic in Ahmadabad. Today we will be discussing the topic of skincare tips in acne patients. First of all, what is acne? So acne is a disorder of pilosebaceous unit. Now what is a pilosebaceous unit? So there are numerous hair follicles present on the face, on the arms, shoulder, back, chest, everywhere. At the part where the hair comes out of the skin, there is opening of the gland called sebaceous gland, which is oil producing gland, and beneath that there is a muscle called erector pili muscle. Now combination of the muscle, the gland and the hair follicle makes a pilosebaceous unit. The gland is inactive during childhood. It becomes active at the time of puberty. Because of hormonal changes, the gland starts producing oil or sebum. Now when there is excess production of sebum, there is hyperkeratization of follicular canal. The sebum gets blocked beneath the skin and this is called comedone. When the skin is covered, it is called closed comedone or whitehead. When the skin is open, it is called open comedone or blackheads. These are non-inflammatory type of acne lesions. Now the comedone is there, the gland is producing more and more oil, which leads to bacterial colonization, inflammation, leading to inflammatory type of acne, which are papules, pustules, nodules and cysts. Depending on number of this inflammatory and non-inflammatory lesions, acne can be classified into grade 1 when there are pronounced or more prominent comedones and few papules are present. When along with these things few pustules, 1 to 2 pustules are present, it is called grade 2 acne. When along with pustules there are 1 to 2 nodules present, it is called grade 3 acne, and when the prominent lesion is nodulocystic, it is called grade 4 acne. This is important because your dermatologist will give you the treatment according to your type of acne. Now the causes. As we discussed, hormonal changes is the first and foremost cause of acne, but apart from that, genetic, those patients whose parents were getting good amount of acne in their teenage, the kids are going to get good amount of acne. Apart from that, food, cosmetic products, particularly oily cosmetic products, pollution, all these things together can lead to acne. Now use of cleansing in acne patients. Now there are so many myths about how to wash the face, how many times to wash the face. So it is said that twice daily face wash is mandatory because you need to get rid of all the pollution, sebum, dust, dirt, everything. Those patients who have to work outside for almost the whole day, those patients who have to work in pollution, they can use their they can wash their face maximum 3 times in a day. More frequent washing than this can lead to very dry skin, irritated skin. The natural oils get rid of because of maximum washing, and this leads to the skin producing more oil, which leads to more number of acne. So it is advisable to wash your face twice daily. The content like salicylic acid, glycolic acid, benzoyl peroxide, tea tree oil, all this help in cleansing products. So you can choose your product accordingly, but those patients who have sensitive skin should go for a gentle cleanser. There are people who have to use makeup almost daily. For this patient, double cleansing is recommended, wherein you wash your face with your face wash first and then you can use micellar water to remove rest of the makeup products. Coming to moisturizer use in acne. So moisturizers should be used in acne, yes, but which type of moisturizers? So gel based, lightweight, non-comedogenic, moisturizers containing ceramides, this type of moisturizers are usually considered good. The best time to apply moisturizer is immediately after bath or after your face wash. Again, do not be very harsh in washing your face, do not scrub your face, wash your face gently, pat dry the skin and immediately apply the moisturizer. Moisturizer which contain oil can lead to blockage, can lead to more formation of comedones. So you have to see labels like non-comedogenic on your moisturizing products. Coming to sunscreens, yes, sunscreen use is mandatory in all the patients. If you do not apply sunscreen regularly, it can lead to post-inflammatory hyperpigmentation, tanning. Again, which type of sunscreen? So sunscreen which are either aqueous based or the sunscreen which are mineral based like zinc oxide or titanium dioxide based are very good for acne patient. 30 SPF is minimum recommendation. And those sunscreen which are oil based should be avoided. Coming to makeup, now there are certain people who have to use makeup daily. So which makeups to use? You can use liquid makeup, you can use aqueous based makeup. These makeups usually do not clog your pores. But oil-based makeup again leads to formation of more clogging, more comedones, and ultimately more acne. If necessary, then and then only use the makeup products. If it's alright, avoid it. If you are using makeup products, it is very important to remove them earliest. You have to wash your face before bedtime, and as we discussed, you can go for double cleansing methods. Apart from the cleansers, the moisturizers and the sunscreens, there are certain topical and systemic treatments available which help in acne. So as we discussed earlier, you have to visit your dermatologist to know which products to use. There are certain very strong topical treatments available like benzoyl peroxide, adapalene, tretinoin. Now these are used for spot treatment. You have to use it only when where there is acne. You have to use it for very short contact time. And then there are certain products like topical antibiotics which you can use even around the lesion, even on the full face when you have too much acne. There are certain tablets available which help in acne patients. And apart from tablets, creams, there are certain procedures like when the patients have comedones more in number, then we go for comedone extraction or blackhead removal. There is device called intense pulse light or IPL available, which kills the microorganism which causes acne, reduces inflammation and helps in clearing the skin faster. There is blue light therapy available. There are black pill, salicylic available which help in get rid of acne. So all these treatments, if required, will be provided by your dermatologist. Those patients who are using benzoyl peroxide, adapalene, tretinoin or are using systemic tretinoin, isotretinoin tablets can have very dry skin, and it is recommended for these patients to use moisturizer 2 to 3 times in a day. Now coming to food in acne. So the food which contains sugar, dairy products, milk or any product which has high glycemic index like chocolate, all this can lead to more formation of acne. It might not be the single cause, but when the patient has acne, they should avoid products which contains sugar or carbs in more amount. Those products which have high fiber content usually helps in clearing the lesions of acne. Again, stress can lead to formation of acne by releasing cortisol hormone. So anything which helps you in reducing the stress, meditation, proper sleeping, relaxation, exercise will help you in reducing the acne. So better to go for it. Again, lack of sleep can lead to cortisol surge. So it is important to make a bedtime schedule. It is important to refrain from digital devices before bedtime. Have proper amount of sleep. Make sleep priority. Less number of or low exercise again leads to more amount of cortisol in the body. So exercising actually helps, but make sure to wash your exercise clothes frequently and regularly. Make sure to clean your phones regularly. Make sure to wash your pillow covers regularly. Apart from this, certain lifestyle habits like smoking, drinking also has bad impact on the health, should be avoided. Coming to lifestyle modification, as we discussed, healthy food, high fiber amount, good sleep, good stress reducing meditation, all these things actually help in reducing the acne. If the acne occurs, you have taken treatment, it subsides and now there are acne scars, what to do? So usually only topical treatment which works on acne is tretinoin, but it does not completely clear it. So there are certain procedures which help. There is a procedure called subcision wherein dermatologists break the fibers beneath the scar. There are other procedures like microneedling, platelet-rich plasma therapy, CO2 laser, TCA pill, cross treatment, punch excision, punch flotation, even fillers and threads. So number of treatment modalities available which can help you in reducing the scar as well. So acne sometimes lead to psychological distress, but proper treatment prevents formation of scar, and even if the scar formation occurred, there are certain treatments which help you in getting rid of that as well. So again, the advice would be, if you have acne, do not self-medicate. I have seen people who have been using besan. Now besan acts as scrub, leads to more formation of acne. Exfoliants in general, physical exfoliants should be avoided in acne patients. It can lead to dryness, it can lead to abrasion, it can lead to inflammation resulting in more acne. Chemical exfoliants like salicylic acid, glycolic acid, tretinoin can be used, helps even, but should be used in certain amount, should be used by asking your dermatologist first. All the home remedies like multani mitti, like besan, there are people who apply toothpaste, should be avoided. These are all the big no-nos. Do not pick, pop, squeeze your acne. Again leads to formation of scar. Again big no-no. Avoid makeup products whenever possible, and if you have to use, go for proper cleansing afterwards. Use proper amount of sunscreen regularly. Do not use sugar based foods. Again leads to too much of acne. Do not go for home remedies. Do not go for parlor treatments. I have seen people who have gone for waxing or scrubbing or Upton use, facials, bleach, and leads to more amount of acne, more amount of inflammation, more amount of burning. Should be avoided. So let the expert or dermatologist help you in choosing right amount of acne products. Do not go for very complicated skincare routine. I have seen people who have been using face wash, then toner, then moisturizer, then serum, then sunscreen, then acne product, then topicals. If you are going to make 10-step acne routine or 10-step skincare routine, it is possible that you might not continue it for longer time. So better to go for simpler routine and follow it for longer time for best result. Thank you so much.
For more such videos, visit or log into DermaVidya.com.